this is called scapula, or the shoulder blade bone, and this bone is irregular bone. It's also termed as a little flat bone here too. It sits in the back of your chest, upper chest, and it also gives rise to the pectoral girdle because it has this articulating surface for the head of the humerus. So when you start learning about this bone, you have to understand that it has a different anterior surface and a little different posterior surface. The posterior surface, or the dorsal surface of this bone, has a spine. You can see this spine, which extends all the way to this lateral aspect, giving you a process here called the acromion process. So again, this part is called the spine of scapula, and here is the acromion process of scapula. But before even we go for that, let's talk about the various different borders. Now this bone, especially if I have to hold it in anatomical position, this bone fits on my left side. So this side is the medial border, the lateral border, and the superior border of the scapula. There is an inferior angle, superior angle, and a lateral angle. So 3 angles, 3 borders. One more time: superior border, medial border, lateral border, inferior angle, superior angle, and lateral angle. Those are the 3 angles and 3 borders. Then we already know that we have talked about the spine of scapula that extend as a acromion process. Above the spine you have supraspinous fossa. Below the spine is the infraspinous fossa, and on the anterior side of the scapula you have the subscapular fossa. So there are 3 fossas: supraspinous, infraspinous, and subscapular. On the medial side you have a cavity here, which is actually not that deep cavity as in the case of acetabulum. This is very shallow cavity, and this is called glenoid cavity. It actually allows the head of the humerus, which is here, this bone here, the head of the humerus fits into it. So generally there are muscles attaching to all these structures around, but then head of the humerus really articulates with the glenoid cavity. The only 2 other things which you need to study other than all these structures which I just given you is the acromion process and this another process here called the coracoid process. So just a quick review: the 3 angles, 3 borders, 3 fossas, 1 cavity, and 2 processes. What are those? One more time: medial border, lateral border, superior angle, inferior angle, lateral angle, spine of scapula, supraspinous fossa, infraspinous fossa, and subscapular fossa. You have coracoid process, the acromion process, my mistake please. This is acromion process and coracoid process, and this is glenoid cavity.